Hi, Osei. It's great to have you join us today to really discuss both the impact and effectiveness of advocacy. I'm John McFarland. I'm head of the U.S. healthcare practice at Odgers Berndtson, and I'm delighted to have join me today Osei Mevs, the Vice President of Government Relations for Acadia Healthcare. Osei has a wealth of experience across his career advocating and lobbying at the local, state, and federal level. So we're excited to get his perspectives today. So let's dive in, Osei.
Sounds good. Thank you, John, for having me.
Certainly. Well, Osei, you have a wealth of experience, as I noted, and a really demonstrated track record of advocating effectively for organizations at the local, state, and federal level. In your opinion, how have the advocacy arena and lobbying really evolved today? And why is it important for organizations to understand the current landscape?
You know, John, I consider myself a little bit of an on-the-ground lobbyist. I like to be in the halls of Congress. I like to be at the state capitol, city hall. And as someone who worked on the Hill and who was lobbied, seeing the evolution over my career has really been interesting. I think technology has changed the game, social media, the different platforms. Before it was, you created grassroots campaigns through associations. Now, what you can do through a LinkedIn, through a Facebook, through other channels is fascinating. You can share information quickly. So, one, you're never alone in your conversation, right? Uh, when you're working with your company, you can share and build examples of how the advocacy will be impactful. I think before we were not, we had to carry the message by ourselves, and it was a solo act for an advocate for a particular issue. But even the smallest subgroups are finding communities where they can communicate, create messaging, and share data that shows the impact. And that's at the federal level. At the state level, best practices are shared across the country. Data points are shared across the country. When Massachusetts and California are compared, how Utah compares to Arizona, those are things that we can bring and put into materials that are impactful. I think the last thing I'd put out there, and I think the transparency of materials. So, I can't tell somebody one thing. It's easy to do a Google search on a company. It's easy to do quality research. We're collecting data that, every company has to own up to their performance, and that it drives an increased performance. So, yeah, I think to sum it up, John, community, social media creates sharing spaces that allows you to refine your message. And then two, data. Your performance is easily obtained and you have to be accountable to that. And especially in healthcare with quality and safety is such a huge piece.
No, it's great to hear your perspective, Osei, and you're right in so many ways. I mean, you're never alone with even your thoughts these days. So it's it's important to know how social everything
Mhm.
is. You and I both know that the healthcare ecosystem at large in recent years has really struggled around solutions to alleviate a constrained and really declining workforce. Um, how might the government really play an important part in creating or helping to create more of a sustainable healthcare workforce for the future?
John, I look at it being in behavioral health, we were dealing with a workforce crisis before. And I think you really have to target certain populations with the tools of government. I think the first thing you do is look at, are there enough residencies? Are there enough people going into med school? Because it's tough, right? Med school is a tough curriculum. And then on the backside, right? So you're losing kids through the churn. Some kids may choose a different route, may choose to go into research rather than treating. So a lot of branches of opportunity, but at the same time, they're all walking out with a tremendous amount of student debt, right? So are we creating programs that contribute to the social good that allow kids to afford medical education, nursing education, dental education, and all levels of the continuum, and give access to that smart kid who may be from a low income family, so they're not worried about cost, and they're going and pursuing opportunities that aren't driven by strictly financial drivers. Can they go serve in an underserved community? Can they go practice in an area that is not necessarily the most lucrative? So those type of things I think are helpful. Technology may be the theme of our conversation, John, but COVID, the pandemic, was also in an investigative opportunity for things like telehealth and telemedicine, getting out to the rural environments through technology. Do we have a screen that you can interact with? And Congress, state legislators expanding that, right? Allowing people to practice longer distance away. I saw a story about surgeons who were at a hospital working with the Da Vinci robot that was on a spaceship, right? So if we're going intersgalactic, we should be able to cross state lines and allow
Wow.
medicine to create access and expand our workforce. And for docs, for nurses, for some of the subspecialties and folks along the continuum, let them practice to the top of their license. And that's a state issue, but you merge, all right, it's affordable. Technology allows that suburban doctor to reach a couple of miles more rural. And then, you remove the financial burden, but you also expand the class. So you have people who may want to practice in rural Arkansas and rural Alaska and urban New York. It gives a platform for these folks to bring their talent to the mix, and that's what we're going to need with the workforce. And really, again, I know it's a future question, but access to that technology early. And I think Congress is working on some things, uh, and they're thinking about it because they know in a lot of these counties we're understaffed and we won't have the clinicians to treat.
Yeah, you said it. I mean, you really lead into um, the next question around technology and uh, all of us see the rise of generative AI and other technology solutions and tools that are really poised to dominate the continued evolution of the healthcare system. And when you think about that and in the aspect of you know advocacy and lobbying, do you think the government really should have a hand in fostering kind of the proper environment to further that innovation and thought leadership in the corporate setting?
Yeah. So, John, for healthcare, it's such a critical service. I think the barriers to entry should be tough, right? There should be rigor around it. And my concern with AI, I have a lot more hope for it, but my concern about AI is a lot of people can get into it quick, right? We're it's learning, or we're learning about it so quickly that we got to make sure we have the right players in the space because it can be a positive game changer in so many ways. I mean, there are companies that, and again, going back to workforce, right? This whole thing is
Mhm.
interchanged. Are providers going to spend their time taking notes, or AI can listen to conversations and put the best clinical minutes together? I mean, that you take some of these administrative burdens off these clinicians, and they'll be creative, they'll have new ideas. um, Care will evolve. So it's a huge positive. I think Congress, you know, this Congress may not be able to do what they want with AI, but in conversations with members of committees of jurisdiction, this is top of mind. And the Doc Caucus in uh, Congress is like, how do we make this work as a positive? And John, everything from predictive clinical outcomes. We have friends here in Nashville who are trying to get their arms around the business case to just, all right, if you give me a little leeway and tell me that this patient's going to have this morbidity, I can treat 10 different other things and make them a healthier patient. The preventative stuff. It is a game changer. I think Congress is thinking about it in the right way, ensuring we have the right quality individuals that will drive us to better health outcomes. And that's what we're trying to do as a company here at Acadia. How do we make sure this benefits the patient and it doesn't become a cash grab, or we're taking advantage of a glitch, but how does this benefit the patient? And we should see in years out health outcomes improving greatly for things that we've been struggling with on the chronic level, at the preventative level. It really should be a game changer for us. And Congress, I think, has their mind in the right place on it.
Well, that's helpful to say. And you look at advocating for something. I think often we uh, inherently think that it's easy. I can advocate for something that benefits X or benefits Y, and here's why. But advocating itself effectively is a certain skill set in itself. Um, how much of that effectiveness is really being able to translate, um, the government um, and social side of things to the business side of things, and vice versa? What should that kind of translation process look like generally?
John, I think it depends where you're coming from. And being someone who's had to, or had the chance and the privilege to work in the business world and on the Hill, they're different worlds, right? I think you look at healthcare as a provider, as a manufacturer, you're working to explain your business, which has two purposes, right? It has the purpose of providing high quality care that benefits the patient. And that's if you're at a hospital, if you work on a pharmaceutical side, if you're a device, your patient is first, right? And then your second one is, how do we sustain through our products revenue that allows us to continue our work, right? And grow the business, hire and pay and create new technologies and build new things. And you're oftentimes, especially on the policy side, you're dealing with folks who have never been in one of your shops, right? They may have been on a congressional tour, but they're creating policies and the rules you work under, but they have never done what you've done, right? So it's how do you tell someone how to ski and they've never been on snow? It's a unique world. And on the same side, flipping it, how do I tell that doctor who has never written a piece of legislation or never had to consider about the wide range this legislation includes that we have to consider this population and we have to put this clause in because there's the Medicare Center. So that translating is so tough. It's I think a lot of times you'll see third party contract lobbyists who are like, this space is a lot safer than being in house because in house you have to work with your team, the strategic plan, the things that start at the board level and trickle down, operators, what is their ground truth, and then take that and say, this is what we need to serve more patients better. This is what we need so we can create more beds, advanced medication, advanced devices. All right. And then you take that conversation to a staffer, a member of Congress, a member of the state legislature. They say, I have transportation, I have education. Tell me where the funding comes from. And that's where you have to be able to merge the two, understand, all right, I don't get 100% of what I want, but I get 75, 85 because it is a game changer. You have to understand who to communicate with so that message resonates, right? So that strategic plan drives value in their eyes. So it's like being a diplomat, John. Uh, you're sitting there working the negotiations, um, and I think the ultimate thing for the lobbyist, the ultimate thing is you got to remember that patient is the driver, patient is served by the company, and that's your home base. So even though we're going back and forth, we are continually advocating for that patient through the company and being considerate in finding value at the same time synergies for government entities.
Well, that's really helpful. The translation and the synergy thereof, and in all of us leaders in the field, we're always looking for ways to be more effective leaders for our particular organizations, our communities, in our environment at large. When it comes to uh, understanding how to be more effective in the advocacy arena, or being able to be more effective at advocating for our cause, and really understanding that inside baseball, what should all of us uh, really take to heart when it comes to like putting this in our toolkit?
Oh, John, you look at healthcare across the board, government is the biggest single payer. Think if you don't understand what your biggest third party client or your biggest payer is doing, you're missing out. Think inside baseball. I love the term just because there's so much nuance in baseball. There's so many particular rules. There's so many different pieces that you have to have an interest, right? And the higher the interest, I've been blessed to have leaders that I work for who are interested in government relations. You know, tell me about who's going to represent this newly created district. What does redistricting mean for us? What do these committee assignments mean? And they're drivers, right? If you want to be on first name basis, you want to kind of know what's important to the senior member of your delegation and how to make yourself important to that senior member of the delegation in your company and your patients. Uh, and then when you're building your strategic plan, you know, where are the resources going? Does that match with the direction I'm trying to steer my company? Um, those are things that you can bring them back to the office and bring them back to the executive team. But that executive team member flipping to page 7 of the Wall Street Journal and seeing that the health committee is trying to create additional residency spots. Got it. All right, that's my workforce conversation. They're trying to bring different technology and funding into the behavioral health spot. We're trying to do that ourselves. All right, who's that member? Let me go talk to their staff. Osei, create that conversation, inform them. So having leadership there is so important. I think the other piece is your subject matter experts. Man, I mean, our chief quality officer, they send me articles that are tied into the specifics, the nuances of what they do. It makes me better at my job selfishly, but it also allows better conversations when we create those connections with the policy teams at CMS. It creates better conversations when you're talking to the fellow that's on the Hill who's interested in behavioral science. And then, John, when your leadership is all about the details of government relations, you bring people into your hospitals, you bring people into your OTP clinics, they provide a better experience that educates the member, allows them to understand the staff's journey, the patient's journey, what will be impactful for improved operations. So it's just, I mean, the exposure, it makes a better executive, it makes a better executive team, a better company.
Well, Osei, thanks so much for the conversation and your time and your perspectives. They are quite deep and helpful and invaluable at the same time. So thanks so much for joining us.
John, thank you. I appreciate it. I think I'm excited for the series and some of the other conversations you're going to have and appreciate the work you and your team do. Thank you.
Likewise. Thanks so much, Jose.